Hello, everybody. I'm Dr. Sharon Levine. I'm the section head for geriatrics here at Massachusetts General Hospital in the Division of Palliative Care and Geriatric Medicine. And I want to welcome all of you to our senior health town hall. We really enjoyed having you and your friends and guests that have found their way to us. We are all hunkered down today looking at the beautiful snow, and this is a wonderful time to be together to learn stuff. We know you all want to know about the vaccine. We know it, we're hearing it from you, and we want to know too. So we're going to learn a lot together. Sometimes we just have to, there's a lot we know and still a lot we don't know, and we're going to have expert advice today. Just to remind you, we're open for business and people are coming into senior health. And we are also seeing patients virtually, and we're happy to see you any way that works for you during this time and going forward. So we're so happy that you're online with us today. And I am going to turn this over to Susan Edgeman Levitan, who is going to introduce our program for today.
Thank you, Dr. Levine. My name is Susan Edgeman Levitan, and I'm the director of the Stokel Center for Primary Care Innovation in the Division of General Internal Medicine. And I want to add my welcome to Dr. Levine's, and we're thrilled that you all could join us today. So a few housekeeping rules before we start. Everyone except for the speakers is muted so that we can eliminate any background noise or any surprises that might interfere with us hearing our speakers. If you can view the speaker on your full screen, or you can go to the gallery view in the upper right corner to see all participants. So if you go up to the upper right corner of your Zoom screen, there's a little thing there that says view, and you can click on which view you would prefer. If your picture becomes jumpy or out of sync while the speakers are presenting, click the stop video, which is an icon in the lower left corner of your screen. Click that, and that will help speed up your connection. And that might be an issue today because sometimes our internet is a little funky when we have weather like we have today. For questions, and we really encourage you to ask questions, please use the chat feature, which is the button in the bottom ribbon right in the middle. But you were happy to try to answer all of your questions, but please don't share any personal medical questions on the chat. And also, please don't show us any medical issues you might want us to see, because anything that you show, we can all see. So if you do have a medical question, we really encourage you to reach out to your doctor directly to get answers. So we look forward to all your questions. We'll do our best to try to answer them. And if we don't have enough time, we'll try to share information after the call. So with that, I'm going to move to introduce our wonderful speakers today. So first, we're going to hear from Dr. Katie Bowman, who is a Mass General Brigham and Women's Hospital Infectious Disease Fellow and a postdoctoral fellow at the Alter Lab. Then she will turn it over to Dr. Ashwin Kotwal, who is an assistant professor in the Division of Geriatrics at the University of California in San Francisco. So we have a national set of speakers today, which we're very excited about. And then Dr. Matt Russell, who is the clinical director of the geriatric section and the medical director of senior health. So with that, I'm going to turn it over to Dr. Bowman to get us started.
Thank you so much. Hi, everybody. I'm Katie Bowman. I'm so glad to get to talk to everybody today. I know that there's so many questions right now as we finally have vaccines that are rolling out, and also as we're in the middle of a surge of higher numbers of cases. So I'm really, really glad that everybody's interested and tuning in and asking great questions. So first, I wanted to just briefly address some of the questions that came in advance. So one of the big questions that everybody's asking is who will get the vaccine first and how is the rollout of vaccine administration going to go? So in the first phase of vaccines, we're administering to healthcare workers and healthcare personnel across the nation, both because these are high risk, highly exposed people, but also because they potentially, they're critical to protecting the nation, and because we want to reduce any risk of transmission between patients as well. And then after that, in the next phase, are individuals with high risk comorbidities, other illnesses that might make them at especially high risk were they to get COVID infection. After that, we see patients that have other comorbidities that might not have qualified in the prior phase, and essential workers, and it kind of rolls on down. And what we're basically trying to do is just get everybody vaccinated, but do so in a way that can really protect those most at risk. In terms of how that's going to work on a more granular level at the Mass General and here in Massachusetts, we're still working on exactly. Everybody's asking where and when and exactly how can I get my vaccine, and we're going to get that information to you, and everybody's very invested in reaching out and making sure that all of you get vaccinated and protected. I think another thing that is really important to talk about is what this vaccine actually does. So both the Pfizer and the Moderna vaccines have excellent efficacy in protecting people from getting sick from COVID. So really what that efficacy data says is that both are about 95% effective in preventing people that got vaccinated with the 2 doses from developing severe COVID-19 illness. Now, I want to also cover what the trials weren't designed to actually test, which is whether people could still potentially be infected but be asymptomatic and able to transmit some infection, because a lot of questions have come in about this. And the trials weren't designed to test that. So what that really underscores how important it is to, even if when you get vaccinated, to still keep wearing your masks. So the vaccine is not a passport to say return to daily life just as before COVID. It's a protection for you, and it's so important. But we still really want to protect everybody around you as well, and make sure that you're continuing to mask and socially distance as you have been. One of the questions that came up frequently was what are the differences in the vaccines, and does it matter which one that you get? So the Pfizer and the Moderna vaccines are both, as I said, about 95% effective. They're both mRNA-based vaccines. And some of this, it gets into the weeds a little, so I'm not going to go too far there, but I think the important pieces of this is that they're using genetic material from the virus both in kind of a fatty, oily mixture, to then incorporate and use your body's own cellular machinery to create viral proteins that you can then create antibodies to that will be protective. And what they don't have is any way that you could get infected from them. So you cannot, it is not possible to get COVID from the vaccine. They're both 2 doses. The Moderna vaccine is 28 days apart. The Pfizer vaccine is 21 days apart between doses. And I think they're both effective across age groups, across race, across ethnicity. And and across genders. And the Moderna vaccine will be approved for, I think, for people greater than 18 years old, and the Pfizer vaccine for greater than 16 years old. And so I don't have any strong preference for any of my patients to get one or the other, and I personally would feel safe getting either. I think one of the other questions that's come up is, what sorts of, and I've touched on this a little bit, but what sorts of precautions do I have to take after I get a vaccine? And like I said, it's really important to continue masking and continue being really careful with social distancing after vaccination, just as before, because in terms of achieving a community safety, it's going to require we're still in the long haul. It's going to require a long period of time before a huge portion of the population is vaccinated, and as we see, infection rates really drop. Let's see. I can walk through a couple of the other the other questions. Do I have time to do that?
Yeah, you can take, yeah.
Okay, great. The one question that came in was, how long do small aerosol COVID particles remain in the air indoors? So we know that COVID is largely transmitted through droplet particles, which are larger particles in the air, but can be transmitted via much smaller aerosol particles. Droplet particles will stay in the air for minutes, in the realm of minutes. The tiny particles can stay in the air for hours. What we know, why that's important, is for situations like indoor crowding and being in an indoor space with many other people, because we know that the safety and how long those droplets stay in the air, really, I can't give you an exact number because it varies so much according to how well a room is ventilated and how many people are there, and how much space there is. And then let's see, when it's our turn, where can an MGH patient get a COVID vaccine? This all is information coming down the line, so you're going to be hearing more about this. And so can anyone there explain how the daily percentage of COVID cases is calculated? So on a national level, we look at the number of positive cases and divide that by the number of positive tests, I should say, and divide that by the number of tests implemented and multiply that by the 100. So that's how we get our percentage. But on a more specific level, each hospital and clinic and public health facility across the nation has infection control employees whose whole job is to really monitor how many cases are there for that hospital. And that data is reported on a state level and then nationally to the CDC, so that we can really get a good sense and a very up-to-date sense of how many cases there are. Let's see. Please explain virus shedding by a person who receives the COVID vaccine. I just want to be clear. I think this is a great question, but I want to be really clear. The COVID vaccine, like I said, cannot cause COVID. The Moderna and the Pfizer vaccine can't give you COVID, but we don't know yet if you could still get infected and just remain not sick, and therefore still transmit virus. So when we say, you've heard the term virus shedding kind of thrown around a little bit in the news, and what that means is that as you speak or breathe, or you might be releasing small amounts of either infectious virus particles or just viral DNA, RNA in those particles. So whether it's infectious virus or just infectious genetic material. Let's see. And that material is what, when you get a nasal swab or a nasopharyngeal swab and get tested, that's what some of these PCR tests that are used to diagnose COVID, that's what that is detecting, is the RNA.
I think that may be the last question we have time for right now.
I think that is most of the questions. I'm
Good.
happy to answer more later.
All right, thank you.
Thank you.
Yeah,
And Dr. Coatwall is next.
yeah.
Hi, everyone. I'm really excited to be here and so glad that these town halls have been happening. I also heard about the snowstorm and I hope you all are staying warm. I was actually living in Brookline during the 2014 winter snowpocalypse. So that's a fresh memory in my mind, but I do miss how beautiful everything looks when covered in the snow. So I'll really try to keep my remarks brief as I'm looking forward to our overall discussion. I was asked to speak about social isolation and strategies to overcome isolation during the pandemic and during this upcoming holiday season. So I think there's a lot of great discussion we can have as a group, and I welcome you all to share in the chat as I'm speaking some of the strategies you've used to help get the discussion going. So in order to think about these topics, I think it's actually important to take a step back for a second and consider why, as physicians and as healthcare providers, we care so much about this topic of isolation. So over the last decade or so, loneliness and social isolation's effect on health have gained a lot of attention in the healthcare and in the media. So in the US, there was a recent National Academy of Sciences report that laid out the evidence for the impact of these markers of social well-being on health and really called for more research, clinicians, and community organizations to actively work to address this epidemic of loneliness. And this is a global issue too. So in the UK, for example, over the last decade, they've had a Ministry of Loneliness and a nationwide campaign to end loneliness. So an increasingly important healthcare topic. So I think of loneliness and social isolation as related but different social experiences. Loneliness is really considered a subjective feeling that your social relationships are lacking. So a popular phrase is, you can feel lonely in a crowded room. So people may have many relationships or even be married and still feel lonely. The factors that lead to loneliness are complex, and loneliness has been tied to a lot of health outcomes like depression, the development of disability, heart disease, dementia, and even death. And we believe that the primary way that loneliness affects health is through stress pathways. So long-standing emotional distress can increase the hormone cortisol in the bloodstream, which leads to wear and tear on the body over time. And this distress can affect your sleep, health behaviors, and how active people are. So loneliness is really this emotional distress pathway. And social isolation, in contrast, is a more objective, measurable deficit in the frequency of interaction with friends, family, or community. So social isolation is what likely all of us have experienced at some point during this pandemic due to the need to physically distance from others. And I think there have been different extremes of isolation that people have experienced. I've had many patients in nursing facilities or assisted living facilities, for example, who've had really severe forms of isolation because they haven't had any visitors, activities have been restricted, and they've really been confined to their rooms for months at a time. And I think at this extreme form, where people are isolated and rarely seeing friends, family, children, or their community, even through the use of technology for extended periods of time, that can really impact people's health. So social isolation can make people feel lonely. And I think this isolation can also impact health through other mechanisms. So for example, when we're isolated and there's a crisis, we're experiencing a crisis, it can be hard to mobilize support to help us with emotional needs, transportation to needed medical appointments, even getting financial support. People who are isolated also can miss out on some of the positive health effects of socializing. The more we learn about aging, the more we recognize that healthy aging is not just about avoiding disease, it's really about active engagement with life. So social interaction can help people stay active physically, improve people's mental health, and can even preserve brain health over time. And people who are isolated don't experience these benefits. But I want to point out that socializing means different things to different people. So it's not a one-size-fit-all solution. So it's important to check in about what is meaningful to you so that we can really think about what would help. So now that we've thought through these two related concepts, loneliness and isolation, let's think about some strategies to help address them. So the first strategy I would suggest is just reflecting a little bit about how you're doing right now. There is so much going on in the world right now that can make us feel lonely, that can make us feel depressed or anxious. And it is really hard to talk about loneliness, just as there are challenges talking about depression or anxiety. I think it's important not to have assumptions about who is or who is not feeling lonely. Loneliness can frequently occur for people who are surrounded by family members, who are married, who have activities they're engaged in. There was a national survey of US older adults that found that over 40% of people occasionally feel lonely. So this is a really common experience. And so I would encourage you, if you're feeling lonely, if that's causing you distress, to tell a health provider or family member and start having a conversation about what might be able to help. So when I talk through feelings of loneliness and have conversations with patients or family members, I've noticed that oftentimes we can think through what might be contributing and what may help. Sometimes what is needed is some more companionship or a person to talk to. And there have been a lot of great programs that have been started recently during the pandemic that can help with this. So there's mentoring programs across generations. There are peer support programs to talk to people with shared life experiences. There's telephone-based friendship lines, and there are support groups. There are mindfulness is one strategy that people use, using telephone-based apps. So these applications can teach openness, patience, and acceptance for our current situations. Cognitive behavioral therapy is a type of therapy we use to help reframe thoughts about relationships, assumptions about people's views and expectations. These strategies are really about helping to cope with loneliness. So how about isolation? So when people are isolated and that's bothering them, it's definitely been more so the case during the pandemic, we can think about strategies to increase our interactions with others. You all probably have tons of examples and gotten creative about finding ways to socialize, especially using technology. And in general, I'm fully supportive of that approach. I strongly encourage, getting together in groups or virtual interactions whenever you can, and to get creative with it. Story time over video with grandchildren, baking holiday cookies while on video, sharing meals together, having game nights, having live performances. If you're exercising, exercise as a group. Anything that can build community together. And I also encourage you to remember that the benefits of social interaction go both ways. So there's so many benefits that family members, whether younger or older, as I've especially seen this to be the case with grandchildren, that they get from your interaction with them. Of course, be mindful of Zoom fatigue. All of us have experienced this. And if you or a loved one feel like you're having trouble keeping up with technology or accessing technology, just remember you are not alone in that. That is extremely common. So reach out to a healthcare provider, reach out to a family member, and we can help to brainstorm to figure out solutions there. There's also a number of great community groups, even in the Boston area, that help people navigate technology issues. So I would also just encourage you to reach out to loved ones and be proactive. So calling, mailing cards or packages, recordable audio greetings. So many of these things that we've been doing throughout the pandemic, now is the time to keep doing those things to support people, especially during the holiday season. The last thing I'll mention before we have a larger discussion is in-person interactions. So I know this has been on a lot of people's minds, and I'll defer to Katie and many of the other clinicians on the panel about the safest strategies here. But much of the balance between safety and risk is on a spectrum. So, and much of it will depend on individual scenarios and levels of risk that you're willing to tolerate. During the last few months, family gatherings have been linked to more spread. And I think about this because, you know, we often relax our guard a little bit when we're around trusted relatives or friends. And there's often travel involved in some of these gatherings. So whatever risk people have taken in the last 10 to 14 days, all of that risk is being shared with everyone at the gathering, and small risk can add up. So in general, during the surge, my general advice is to try to avoid in-person social interactions as much as possible, especially with people outside of our household. And if you're thinking about a gathering, some of the principles I would think about are, number one, try to minimize additional activities in the weeks leading up to social gatherings. So preferably for at least 14 days. And that really means no leaving the house for activities other than medical care. And if you have to, make sure you're wearing a mask. The second is opt for small gatherings with people in your quarantine bubble. Wear masks indoors whenever possible for people outside of your household. The third, have really good ventilation. Airflow in the house, you know, spend time in the largest room as opposed to smaller confined spaces. I've seen people crank up the heat, open up the windows, turn on their best filter that you can, and make sure you have hand sanitizer available. So people are washing their hands, especially if you're using the same utensils. And then lastly, you know, open conversations, setting ground rules are really important here. So if you feel worried about offending someone, you know, we can help you think through strategies to communicate that with loved ones. But in general, people, I think we're all experiencing this pandemic together. We all recognize how challenging it is to not be around family members during this holiday season. And I think we're all kind of finding ways to help communicate this challenge with our family in ways that they'll be understanding, and you know, we can do it safely, hopefully in the coming months. So with that, I will stop. And again, really excited to be here and looking forward to our discussion together.
Thank you. Dr. Russell.
Thank you so much. These are great topics we've covered so far today. My name is Dr. Matt Russell. I'm the medical director here at our senior health clinic, and I'll be speaking to what we're doing in our geriatrics office. And if you have a provider at another practice, feel free to just verify with them that they're doing something similar, as people might be doing different things from practice to practice. So first and foremost, I think many of you know we are very much still open and active in terms of seeing our patients in the clinic, both in person and virtually, to the best of our ability. Actually, to the best of everyone's ability, because sometimes it ain't so easy to be on the virtual calls. It's important for you to understand that we are able to meet your needs. We have relationships with alternative to hospitalization programs that allow for more point of care evaluations to keep you safe and in home and reduce your risk of hospitalization. Now that works based on the early alert system before it becomes an emergency. And so we just want to remind you that if you're starting to feel lousy and you think it might be concerning, please reach out to your primary care team and say, hey, this is going on. There's a lot we can do in real time to just pop in. Maybe it's an issue of we should check some blood work. We'll have someone come to the house and draw the bloods. Or it sounds like you're a little wobbly. We'll have a physical therapist come and set that up. We'd rather treat the weakness than treat the fall and fracture. And through all of this, we talk about, despite the fact that COVID is raging right now, we still have our high blood pressure, our emphysema, and our diabetes, and our arthritis. And we want to make sure that those issues are managed actively. For many of you in our practice, you know that we're seeing our patients on a 3-month cycle, and that's because it's important to stay on top of the many conditions that our patients might have. That doesn't mean we can't see you in the in-between times if something comes up, as it often does around the cold winter months. We are open, just to let you know, we are open for new primary care patients, and we are also open for geriatric consults. And what that means is if folks want to keep their primary care doctor, but they feel that a geriatric assessment would help them with something they're struggling with, whether it's a decline in physical function, some slight memory problems, or trouble managing and coordinating complex care like multiple appointments and what we call doctor soup, where there's a lot of us in the kitchen stirring and are we actually talking to one another. So I encourage you to let your friends and acquaintances know that, and certainly come on down. Lastly, just to build on what Dr. Cotwall said about the virtual offerings, please check with your local aging services access point, which is basically a clearinghouse for senior programs. They didn't really have a lot of programming in the first wave, but they have now gone online and are starting up good online programs that are both social and also related to things like exercise. So I'd just encourage you to do the research with your local senior center to see what their online offerings are. Lastly, if you have friends or family who are struggling with technology and you're a bit talented with it, please help them. Please help them get online. There are a couple of different places where people can learn how to use Zoom. There is a Zoom tutorial, a telehealth Zoom tutorial on YouTube that you can just search for. There's a nonprofit organization called seniorplanet.org. It's just seniorplanet, all one word, .org. They have free class offerings in exercise, meditation. I think they have a book club, and then they also have technology assistance. So they'll teach you in a class how do you use Zoom and stay connected. Finally, I just want to also make a plug for our Ageless Grace program. So that has started up again, and Nori Mazzoni has put in the chat function her email. So please feel free to email her and get the Zoom link for her exercise class, which we did in one of our earlier town halls. That was absolutely joyful and fantastic. With that, I will pass it back to Susan for some more Q&A, or feel free if there are any other questions. I'm happy to answer questions related to our practice.
Okay, thank you. One quick thing that I just want to mention before we go to the specific questions is that right before this town hall today, our Department of Medicine at Mass General had a town hall about the vaccine and the vaccine distribution for our employees and also for patients. So one thing that I think we all learned there is that right now we are developing a frequently asked question document that will be prepared just for our patients. And I think it will address many of the questions that are coming up here about how to schedule an appointment to get a vaccine, what are some of the risk factors you need to be aware of, and other basic information, I think, about the vaccines. So when I've seen a question here about, should I call my physician's office to sign up? I don't think we're ready for that yet. And I think that one thing I would just remind people is that right now, all of our practices are doing everything they can to respond to all the questions they're getting, but it's an enormous amount of work for the staff. And so recognize that we're going to be sharing information, very concrete information, as soon as we have it. And anything that we can do to not burden our staff with questions that they actually don't even have the answers to yet is really, really helpful. The other thing I would strongly encourage people to do, if you haven't done it yet, is to sign up for Patient Gateway. Patient Gateway is our online patient portal. You can just Google Patient Gateway and you'll get there, because all of the information that we will have about the vaccine availability and how to schedule appointments will be distributed to everybody who's a Patient Gateway member. So those are just a couple of suggestions before we get to our questions. And I also just want to call attention to some of the other resources that people have listed in the chat that I think will help with the loneliness and isolation. So there's one here called Bridge Base and online, and I'm assuming that's an online way to play bridge with other people. Another one, Ticket to Ride online. I'm not quite sure what that is. I could think that could be music, that could be exercise or something else, but I certainly want to encourage people to look at Senior Planet. It has tons of information and really fun things. And then the other resource I want to mention, and there may be some people on the town hall today who participated in this, is the Osher Lifelong Learning Institute, which is based at the Institute for Gerontology at UMass. And they offer all sorts of courses that are taught by many of our university faculty. And it's a very robust, strong program that I would encourage people to take a look at. So with that, I'm going to go to some of our questions. So the first question I'm going to give to Matt, and that is dementia considered a comorbidity? And are people with dementia at increased risk for COVID?
That is a really great question.
Yeah.
And I think that as we look at it's more situational to the level of care and the severity of dementia. So for example, early stages, probably not. But if you're in later, more advanced stages in which you're having increased numbers of care providers coming into the house, or you're required to, you're living in, say, a nursing home, that would be a risk. But I think dementia by itself can lead to things like maybe not practicing hand hygiene, trouble wearing masks when you're going out in public. So not something necessarily intrinsic to the disease, but more to the behavior that might put people at risk. And we have that in our clinic. We'll see patients who come in who have cognitive impairment, really can't wear the mask or don't understand what it's for. And we take precautions to get them into the room as quickly as possible and to make sure that our healthcare providers are maximally protected in a way that doesn't frighten the patient. And we found it works pretty good.
Great,
well.
Thank you. The next question I'm going to direct to Dr. Bowman, and that is, if you're on chemo, an immune suppressing drug, are you eligible for the vaccine? And then there is another related question in some respects, that is it okay to get the vaccine if you've recently had a vaccine for flu or shingles? So maybe if you could take both of those.
Yeah, so if you are on chemotherapy and there is some variation between different chemotherapy regimens in how immunosuppressive they are, but in general, yes, you're immunosuppressed. Now, exactly, the when the timing of your vaccine would be, I can't answer that yet. We'll get there soon, I hope. As far as the shingles and the flu vaccines, generally, because this is a relatively brand new vaccine, we do try to kind of separate out a little bit from other vaccines. So your healthcare providers probably won't be giving you these vaccines on the same day, especially as we want to be able to monitor symptoms on this vaccine. But that said, they're not going to prevent you from getting the vaccine if you've had a shingles vaccine, say, a month ago.
So I'm going to go back to the question about chemotherapy just for another second. If you are on chemo, are you eligible to get the COVID vaccine?
That's a great question. I believe so, but I really want people to talk to their oncologists and their direct care providers to get a more kind of individualized answer to that.
Great. Great. Now I am just looking down. Okay. Yes, we've got a question about sending out the social websites, and we can do that. I'm looking to see if there are other questions that have
Actually,
come.
Susan, can I just?
Sure, jump right in.
I just would encourage everybody who's found something that works, please put it into the chat function. We have a small group, support group, where we do a virus vent, and we've come up with a lot of really great ways that folks who are separated from their families, especially their grandkids, have found ways to connect over the internet, and even just techniques. One of our folks was doing a bingo game online with the grandkids. Another was doing a chess game between two sets of grandchildren. And it's just these kinds of things are like many things in complex situations. It's sort of trial and error, but the more ideas one has, the deeper one's pockets are.
Yeah. I just have one quick one that I love. One of my best friends has a new grandson, and she and her husband are in Oakland, California, and the grandson's in Durham, North Carolina, and he's just about 9 months old, and they actually FaceTime together every single day, and he is now talking to them, which they find to be hilarious. So I think anything you can do like that to connect with friends and family and grandchildren, godchildren, I don't care who they are. It's really, I think, it's inspiring, and it helps us all. Another question, though, that I think is really important is, and this is for Dr. Bowman, how long after the second dose do we think it will take for people to actually be protected? When does the immunization really kick in?
Unmute. That is an excellent question. So the data that we have coming out really shows that the number of cases of COVID really leveled off entirely after I think 14 days after the first dose. That doesn't mean that you don't need to get the second dose, but we think that in about 2 weeks after the first dose is when your immune system starts to really kick in. Now, in terms of how long that protection is, we need more data. We need longer term data to really understand that answer. I saw that question pop up somewhere in the chat, so I thought I'd
Yeah, go right ahead. Okay, there are lots of great suggestions coming in, and I'm going to just share one quickly, and I'll write it. But if you like to cook, there is a wonderful chef who has a restaurant in Wellfleet out on the Cape, and he has pivoted to doing Friday night cooking classes on Zoom, which are very inexpensive and really fun. His name is Michael Ciraldi, And my daughter and I have done several, and we really enjoy them. So I'm going to put his website in because I think it's something, and all the recipes, it's amazing. They're amazingly simple and delicious. We just did one where we learned how to make tiramisu, which he called tiramisu, which I think we all loved. So I will put that in. So we have another question. Is it safe to walk in a mall with others with the mask on? And what do you think about tennis indoors?
I could start answering
Yeah,
this question.
Dr. Kowa, yeah.
And also, I like the tiramisu. I would say that none of those activities are zero risk, but I think it really depends on how many people are around and how well ventilated the area is. So, for example, tennis indoors, I think these are large courts, probably generally well ventilated, so probably a lower risk activity. But people are also using a lot of, exertion, running around, might be closer when they're at the net. So I think probably a lower risk activity, so reasonable, but not a zero risk activity. Welcome Katie to weigh in there as well. As far as masks at malls, I think we've so frequently been seeing malls quite crowded. And so I think the more crowded the space, the more risky it gets because there's so many potential exposures, and masks are not 100% guarantee of reducing that risk of exposure. So in general, I would suggest probably avoiding the malls, and potentially tennis may work in certain scenarios.
One thing I can add to that about tennis, and this is not a professional perspective, but I know that there are some indoor tennis clubs in Boston, and they have all just closed this week because of where we are with our with the virus. They've been open with lots of precautions, but they've just closed. So for what that's worth.
Yeah, I do think that what were probably low risk activities a few months ago, that risk has changed now because of just a higher level of community spread. Even low risk activities are a higher risk these days. So I think if they've closed down, I think that speaks to what risk people are willing to tolerate right now.
Yeah. So we have another question, and I think Dr. Bowman, you may be able to answer this, but so would Dr. Russell and perhaps Dr. Levine, and that is, what is the anticipated date? Do we have any idea about when phase 2 will kick in and at-risk older people may be able to start getting vaccines?
I don't have that exact date. I don't want to throw a date out without it having more certainty behind it.
Yeah.
Those people on Patient Gateway, and this is just to echo what Susan said about signing up for Patient Gateway and making sure, this kind of a program is not a practice-based rollout of vaccination. This is going to be the whole Mass General Brigham system figuring out the best strategy for it. And so whether it's coming from a practice or more likely from a vaccination sort of center, that has yet to be communicated. But my understanding is that there are plans to roll these communications out, obviously, in the next. This is the question we want. Our vaccination program yesterday started up so we could sign up to get vaccinated, and it was kind of clunky, so they put it on hold, and we're having to go and manually sign up for now. So what we don't want to do is, obviously, when we're doing a patient facing program, we don't want there to be any kind of technological challenges. We want to make it fairly straightforward. And so our understanding is that the leadership, the incident command that's been activated at Mass General and the Brigham system will be communicating from a central source to all of the patients.
Yeah.
There's a comment that I wanted to make. which is, and it's really, it's a sort of a psychological construct, which is that we tend to think that people we know are safe, or that the people who are in our families, and we have a different standard for interacting with those people. And I think a lot of the trouble we're in now with this surge post Thanksgiving is because of that. And I think it's really important to just assume that we're surrounded by asymptomatic carriers. And I think if you make that assumption, because they're not bad people, this is a very, very contagious virus for all the reasons that Dr. Bowman talked about. It's not just droplets, it's aerosolized, and we shouldn't make the faulty assumption that people we know are any different than anybody else, and that it's really the proximity, and it's the exposure, and it's why the holidays are so incredibly hard, and they have been hard all year, is because we're dying to be with the people we love or who are our friends who we don't get to see, and everybody's in a rush to do that. And I think this is a time that is so hard and really requires some patience on our part, or getting tested, right? If you're going to see people or be with people, everybody has to get tested before you get together. And that may mean that people have to pay for it depending upon where they live, or if they're coming in from out of state, et cetera, et cetera. So it's not just somebody else who's carrying or possibly infectious. It's all of us. And I think it's a psychological thing to wrap your head around this, because we tend to trust the people we know, but nobody really knows. And there is a lot of asymptomatic carriers, and in small spaces in people's homes, that we know. And that's going to be the case. This was advice that we got before Thanksgiving, and we really need to give it, now that it's Hanukkah time and Christmas time, it's the same thing. And boy, is that hard, because we're all just dying to be with grandchildren, children, friends that we haven't seen. And we're going to get there. I have no doubt we are going to get there. We've got to get vaccinated so we can take care of all of you, and then you'll get vaccinated eventually. And then we'll be able to do this. We're going to be in masks for quite a while. I think Dr. Bowman would agree with that. There's going to be a long time that we're going to have our masks on, and we're just going to get used to it. And that will continue on until everybody is really vaccinated and we've got some coverage in the country. So I wanted to say that because I think about it a lot, and I think about how I feel too. I mean, I get together with my friends and they think, okay, come and sit in the backyard. And it's like, how do I know? How do I know that I have not been exposed or you have not been exposed?
Yeah, I can't echo that, everything you just said, enough, because it's I think a very natural human tendency to say, well, I trust my family, I trust my closest friends, I know that they're being as careful and concerned as I am. But it's really a math issue. If you multiply a lot of small risks, people who are relatively low risk together, that risk really adds up. And unfortunately, I think it's a natural human tendency to rationalize some of those exposures, especially when you want, you're craving your family and your close friends. So it's a good time to take a step back and tell everybody really in a really open way that, that you care about them and that you're also really invested in taking precautions.
Yeah. I think we have time for one more question, and I'm going to direct this to Dr. Bowman. And that is a question about what do we know about the efficacy and the reliability of over-the-counter tests? Are they worth purchasing? What do we know about them?
It's a great question. So I think the question, I think, got sent in advance, and it was the last question that I didn't get to before. It's most of the at-home tests are antigen-based tests. So looking at protein rather than genetic material. They are quite good. That said, they're not quite as good as the PCR testing that's done in hospitals. I think it's really a question of the slightly larger number of false negatives and false positive tests that might result, and balancing that risk. So I would never tell people absolutely don't test if the alternative is to get tested. And I think that if we could get to at-home testing for a huge percentage of the population, I think that could go a long way in helping us control infection.
Great, thank you. And actually, I never say never. Dr. Russell, I have a question for you, and that is, if you are a senior health patient, should you be waiting to hear about getting the vaccine at senior health? Should you be looking at drugstores, other local hospitals? How should people think about that?
So that is a very, very important question. We obviously don't want you to get vaccinated twice. And because this is government distributed in a lot of ways, that won't happen. So we will have our own rollout of communication and let you know when our patients will be, scheduled and how they'll be scheduled. If there are other ways of getting the vaccine, I don't think that there's any particular reason not to. But if you're in two lines and you're preserving a space in one line that could be used by another person, and you know that you're going to get vaccinated through your providers here, I just ask you to take that more compassionately into consideration.
I also think, and Dr. Russell and Dr. Bowman, correct me if that's wrong, but I think the other thing that we have to pay attention to is what vaccine you get, and then when the follow-up vaccine will be required, because you have to get the same vaccine. If you get the Pfizer vaccine, your second dose should be the Pfizer vaccine, et cetera. And so that's also an important consideration to keep in mind. But I want to make sure that that's accurate.
That's correct. You do need to get the second dose of the same vaccine that you got the first dose.
Right.
Our vaccine plan for the employees, when it goes live, when we get our first vaccine, at that vaccination visit, the second vaccination visit is scheduled, so that and that will most likely be standard wherever you get your vaccine.
Great. Great. Well, I think we are almost out of time. If I'd thought about this in advance, I would have asked Dr. Russell to sing to us today to help us end with a wonderful holiday song.
Oh, wow.
I don't know if we can persuade you.
I'll need something stronger. Right. Certainly Winter Wonderland is coming to mind, so feel free to enjoy from this side of the window the beautiful winter landscapes if you happen to be up here in the Northeast. And if you happen to be down in the beautiful Sun Belt, we are now in a fight with one another. So stay well, stay healthy wherever you are.
Yes, and we wish everyone to have a wonderful holiday. And please take advantage of all these great suggestions that people shared today. So thank you to our speakers, and we'll see you back in January.